Hello and welcome to the Patients Engage podcast today. The topic today is after bone marrow transplant, navigating GvHD. This is part of our lived and leading Voices for Better Healthcare, where we feature persons with lived experience of a condition or a disability and how they're channeling their experiences and learnings into improving healthcare. They could be providing peer support or could be advocating for changes in the health system. Patients Engage is a platform that empowers people with chronic conditions and disabilities to engage better with their health and make informed decisions. We also advocate for more meaningful involvement of people living with long-term conditions in health system decision-making. I'm Aparna Mittal from Patients Engage, and today I'm speaking with two special people in episode 10 of Lived and Leading. Neerad Trivedi is a long-term survivor of blood cancer, CML, AML, and bone marrow transplant. And he's also a director of BMT Support Foundation and a patient advocate. Nikhil Aggarwal, who is a doctor by training, also has come in one of our earlier webinars, is an AML survivor and again a BMT survivor and a patient advocate on issues specifically relating to chronic GvHD. So let's start with some background information. What is BMT or bone marrow transplant? It's a treatment procedure by which hematopoietic stem cells, which are also called HSCTs, are responsible for development of all types of blood cells, and they are infused into the human body. Earlier, these stem cells were typically harvested from the bone marrow, so it was called bone marrow transplantation. Today, they are harvested from the peripheral blood or the umbilical cord, and therefore they are referred to as HSCT, which is hematopoietic stem cell transplant. If the stem cells are harvested and infused into the same person, then it is called autologous. But if it's harvested from a different person, it is called allogenic, where the stem cell donor can be a matched sibling, a matched unrelated, or half-matched donor. The half-matched donors are also called haploidentical donors. A typical BMT, will have collection of the stem cell, which is called the harvesting, preparing the recipient's marrow for receiving the stem cells, which is called conditioning, and infusing the stem cells, which is called transplantation. And there's obviously immunosuppression so that the new stem cells can be accepted by the body and engrafted. BMT is now also done for other blood disorders like thalassemia and sickle cell, but here we will focus on the experience of two blood cancer survivors who've gone through BMT. Also, I think an important term that we will be referring to in today's discussion is GvHD, which is graft versus host disease. It's a serious, sometimes fatal complication of allogenic stem cell or bone marrow transplants, where the donor immune cells, that's the graft, views the recipient's body, which is the host, as foreign, and initiates an inflammatory response and attacks tissues. It affects about 20 to 50% of recipients. So it's a fairly wide range, but that's where it is. And I think we will be referring to two types of GvHDs today: acute, which typically occurs within the first 100 days after the transplant, and that's called acute GvHD. And then you'll have chronic GvHD, which typically develops 6 to 12 months later. And these can be slightly different symptoms. So that's a long explanation, but we just want to make sure that everybody's on the same page. So thank you, Neerad and Nikhil, for joining us today and for sharing your experiences. If there's anything that either of you would like to add to the explanation of BMT and GvHD, please feel free to do that. So
you have done that perfectly. There's nothing more to add.
Okay, thank you. So I think if you could introduce yourselves and especially, who you are as a person, kind of beyond your lived experience of blood cancer or bone marrow transplant, right? So if you can, Neerad, do you want to start?
Sure. Firstly, I'd like to thank you so much for inviting us on the call. This is a topic that really needs a lot of attention in India, especially in today's time, when the number of bone marrow transplants are increasing. So thank you so much for taking this topic. Yes. So in terms of introduction, I grew up in Chennai, so I'm more a TAM boy with a Guju root base. So that's very unlikely of this thing. Management graduate in finance with a cost accounting background. And worked with several multinationals for years, but last 10 years I've been focusing my energies on the social sector. And so worked with different projects in terms of the social projects at the Gandhi Ashram in Ahmedabad. We have worked with blind children, we worked on education, women empowerment, organic farmers. And then in the last about 5.5 years, we've started BMT Support Foundation, which is an NGO to help patients navigate the journey for BMT. Apart from this, I love to cook and obviously spend a lot of my time reading the Upanishads and the sacred text. So, that's who am I for what. Thank you.
Thank you, Neerad. Welcome to the show. Nikhil?
Hi, thank you so much for inviting me for this wonderful session. And as Neerad said, this is a very important topic because transplants are increasing and information about GvHD is much less available and people are not aware about it. And it's one of the serious long-term issues which transplant patients face very frequently. So my introduction, I'm Dr. Nikhil Aggarwal. I'm a general physician and I completed my graduation in 2010 and just 2 years later, I was diagnosed with blood cancer. Apart from blood cancer, what my life is mostly about enjoying whatever best as I can. And that has been my motto since childhood, since adulthood, whenever I could do things as per my wish and whatever I wanted. So, most importantly, I love traveling and I have been traveling throughout my cancer journey before the diagnosis and even after diagnosis till today, as much as my health allows, whenever it is possible. I like to spend my energy, my resources in traveling. And I'm also involved in some social activities, not in proper NGO, but in many cancer awareness groups and programs, support groups, and direct patient counseling. And also have my YouTube channel where I try to make some awareness videos and travel related videos also. That's all.
Thank you. Thank you, Nikhil. So, I know both of you are long-term survivors, over 10 years each. So if you could, again, each of you share a quick recap, and I know it's a lot to recap in like a couple of minutes, but if you could recap from diagnosis to blood cancer to BMT. And maybe Nikhil, you can start.
Okay, so I was diagnosed in July 2012. I didn't have any symptoms at all. I just went for a regular blood test and my counts were very high and it was indicative of blood cancer. After that, bone marrow biopsy was done, which confirmed a diagnosis of AML leukemia. And as with almost everybody, when it was diagnosed, everybody was uh, totally sad. And sad is a small word, I would say, totally hopeless. And it was like as if I won't survive. It's a death sentence, as most people think, which is today I can say, which is absolutely wrong. But yeah, it was that time like that only. And same day of my bone marrow biopsy, I was admitted for chemotherapy. First admission was for 1 month, and from the day of diagnosis till 30 days, I was in hospital getting chemotherapy and all kinds of side effects and physical, mental, emotional, all the turmoil. And but still, I was quite strong that time. I don't know what was the reason, but the diagnosis of cancer didn't affect me as much as it affects usually most of the people. My family was definitely shattered, but I was somehow okay. I accepted it very soon, and that is one thing which helped me uh, fight through all this thing. And after all the chemo sessions, I had stem cell transplant in December of the same year, 2012. Uh, my sister was my donor, and my transplant was done at CMC Vellore, which is considered one of the best institute. And that's how. So after transplant, my disease was in control my transplant was successful and results were very good. But 7 months later, in October of 2013, I had relapse, which was like again very unexpected, and that shattered me also. I mean, before the relapse, I was quite good during diagnosis, transplant, every step. I was much calm and composed. But during relapse, I was also shattered, and the treatment of relapse was also much aggressive compared to the initial treatment, and that kind of broke me a little. And after that, the DLI was done, that is donor leukocyte infusion, which is like a mini transplant. And since that DLI, I am cancer free.
We'll come back to you. I think we need to unpack the actual BMT process, but
Right.
maybe we will start. And for those of you who are listening, actually, we have a full session we've done earlier with Nikhil a few years back, I think a couple of years back, where he's talked of his, that part of the journey in a lot of detail as well. So Neerad, if you can also give us a recap of your journey till the BMT stage.
Sure. I think I'll do it really quick. CML diagnosed in 2011. I was on imatinib for 5 years. In
So if you
2000,
can, so I think, yeah, we are saying AML and CML. So CML is
yeah, so
chronic.
chronic myeloid leukemia was diagnosed in 2011. I was on a medication called imatinib for about 5 years. 2016, there was a change in mutation where the only option at that point was a stem cell transplant. And so, yeah, in the March of 2016, I underwent a stem cell transplant. Transplant per se was all right. But when so there's a virus called, cytomegalovirus that nearly took my life. And all this was within the first 100 days. Yeah, so having gone through that, there was acute GvH and then followed by chronic GvH and stuff like that. So it took some time to settle, for a few years. But now I'm completely disease free and living the life to the fullest. I just completed a 5K, marathon this Sunday. So all in all, good. Thank
Right.
you.
So tell us, one of the things that people really worry about the BMT is that whole isolatory experience, right? How was that? And also, how much do you get a sense of those, what we call acute GvHD, which is within the first 100 days, right? How much of that is in the control of a patient or their family member, and how much of it is really dependent on the healthcare team? So, Nikhil?
Okay. So BMT experience is definitely terrifying. And as you said, the isolation part is very difficult. I was, as I informed earlier, much better mentally during my initial diagnosis and BMT, but still that isolation part was quite difficult because during transplant, there is a very high chances of infection, and patient has to be kept in special isolation rooms, which are specially designed so that risk of infections are minimum. And a patient has to stay there for usually 20 days, 30 days, and it can be more or less depending upon the overall recovery of the patient. And only doctors and nurses are allowed in that room. Patients, caregivers, or relatives can come just for maybe 1 or 2 hours is the stipulated time during a day. And apart from that, whole day the patient is alone. And for staying alone for so many days is quite difficult. A lot of people have experienced that isolation thing during COVID times, and COVID was just a once in a lifetime thing, and it was for patients who were very severely affected.
Correct.
And for a transplant patient, that BMT duration of isolation is quite difficult, again, physically as well as mentally. And
it's also longer, right? COVID,
it's also
were
longer,
isolated
right?
for, initial first wave was 10
First,
days
right,
something, but then, the BMT ones are long.
right. So that is one thing, and because of high risk of infection and very strong chemotherapies, a lot of people have to undergo total body irradiation also. So there are lots of treatment related side effects, and again, there is so much of dilemma whether we will survive or not, what will be the outcome.
Hmm.
So all those things add a lot to the patient's mental psyche and emotional turmoil. During my transplant, I was admitted, I think, for around 20 days, and uh, after the actual transplant, I developed severe mucositis. I mean, there were lots of side effects, but this was something which was most aggressive, and I couldn't eat. I couldn't even take a drop of water. It was that severe, and right from my lips, mouth, esophagus till stomach. So around 10 days, I was on IV nutrition. I couldn't take anything at all, and when I was discharged, definitely there was a lot of uh, good sense because I had survived the BMT process, but even after discharge, for at least 7 days, I couldn't eat properly because all the taste buds and uh, all the system changes a lot. So that was quite a hard part. But yeah, I was hopeful because, as we say, there is light at the end of tunnel, and the doctors, nurses, all the staff were very cooperative, very helpful. They were giving their best treatment as well as a lot of emotional support. So the thing was very difficult, but it passed. And after
Right.
the transplant, I had acute GvHD of skin, mouth, and skin, mouth, and gut, and liver also. But my GvHDs, acute GvHDs, were not very severe. The
Hmm.
skin rashes were quite uh, severe compared to other GvHDs, but they were also managed. And if you talk about prevention, during BMT process only, on the same day or few days before that, they start some medicines like cyclosporin and methotrexate to prevent GvHD. But as such, patients can't do much about that. If it has to
Right.
happen, it will happen. And in fact, little bit of GvHD is good
Is
for us.
required. Is
Yeah.
required. Right.
So as you said, the graft cells, they attack host cells. So in a similar way, they also attack the leukemia cells or the cancer cells. So having little bit of GvHD is good to reduce the chances of relapse. And there is nothing much which patients can do. But once you get GvHD, there are things which we can do to minimize the symptoms or to have better relief.
Okay. Thanks, Nikhil. Neerad, your BMT process, and I know you mentioned CMV, but you can elaborate a little bit on your BMT,
Sure.
and also how were you fully aware of what was going to happen, and were there surprises along the way?
Okay. Uh, so I think very similar experience to Dr. Nikhil in terms of what you go through in the unit. But at least thankfully for me, the caregivers were allowed in the unit, obviously with the entire mask and the operation theater like coats that the doctors wear. Uh, and I think thankfully for me, the last 5 years, which is from 2011 to 2016, we were in search, of our inner self, and therefore we did some meditations and stuff like that. That really helped us to see this process through during the first 21 days, and I think that was a blessing in disguise that we kind of were able to take out that time so that we could, So I'd actually decided the first 21 days pretty much in silence, except for when it's kind of needed to talk, so that I could observe what is happening with me. And that was really helpful. So the transplant that way, I think seemed okay, except for some fevers and stuff like that, which is very, very common. I had mucositis too, yes, right from the eating troubles to everything. I think many of them go through this kind of issue. So very similar. And then once I was home, but had to be readmitted in the next 5 days again for CMV. And that was the tricky part
Hmm.
because by then, CMV had really kicked in and acute GvH in parallel had kicked in with the cytomegalovirus. So that was, quite a combination. And including where I had to be taken, for dialysis because my kidneys got affected because of the treatment of CMV, so they turned out to be nephrotoxic. So yes, so when the dialysis word is kind of used, you think, oh shit, this is the end of it, right? So I had very, very bad phase during that time, at least a week or 10 days, where it was extremely difficult for me. And I was at the verge of collapse where I said, let's just go home. We know what will happen now that kidneys are kind of failing and stuff. But yes, I think, the family, friends, and some mentors really stayed very strong during this process to help me pull through. So that's when we realized the need for support during that time, which was so very essential for us, and how, it could help navigate this particular situation, which was so delicate, both mentally stressful. Yeah, in fact, I just finished writing a book on this in terms of, the experiences of the transplant and how the learnings from the sacred texts helped me understand what was happening with me and stuff. So, all in all, I think, there were a lot of learnings. But one very critical learning during this, which I would like to share in this podcast, is there is a time where there is patient guilt versus
Hmm.
chronic fatigue of the caregiver.
Hmm. Hmm.
So when the caregiver fatigue kicks in with the guilt of the survivor, it's a very, very deadly combination to kind of manage and take care of. So
Hmm.
I think this is a phase where definitely help from different support systems would really help the patient to kind of navigate.
So
So
how do you
this was one.
recognize that point and also recognize that, and sorry if I'm
Yeah.
interrupting.
No, no, please.
Yeah, so I
I
just want
think
to understand, how do you recognize that you're now at that stage where you need help? And often caregiver fatigue is not really spoken about. So,
correct.
it's whether as a patient you recognize it, or is it on the caregiver to recognize it that, the patient guilt is kicking in or the survivor guilt is kicking in. So how does a family system recognize that?
It's a very delicate part because what happens is that both of you are fighting different battles.
Hmm.
While the caregiver is fighting the battle to ensure that everything is taken care of, from medication to your health to taking care of you, finances in the back end, insurances, billing, everything, right? So there's a different battle that they are battling with. And there is a patient who's kind of battling this entire mental fog that happens due to, medications, chemotherapy, health wise, he's not able to eat, all of that, right? So unless there is a very high level of communication, which is transparent, clear, and non-judgmental between the caregiver and the patient,
Hmm.
it becomes very difficult to recognize this aspect, right? Because many
Right.
times you're saying, look, I kind of seeing, like see you doze off. Why don't you take a break for a couple of days and have somebody in?
Hmm.
But again, for somebody else to replace you is so difficult for the
So
caregivers to say, I have really pulled this through so long, right? Let me do it for a few more days.
hmm.
A few more
Also,
days.
it's also very difficult to
Yeah,
compartmentalize and say this I can outsource to somebody
correct,
else, right?
correct,
So,
correct, correct. So I think having very good, transparent conversations is one. Secondly, recognizing and accepting that I'm going through something either as a patient or as a caregiver is very important. Because I think one is that, you have this entire survival instinct that has kicked in, right? And at the other end, there is this entire, like, I want to do everything for my loved one, kind of, both of them kind of kicking in at similar points. So rather than kind of looking at it from that space, we both say, look, we are going through this. Let's go through this together in a way where we will be able to manage this, and not break down in this process. So this constant communication is very important, and caregiver needs to have a backup for sure. Patients have a whole lot of backup from doctors, nurses, psycho-oncologists. There are so many people who really take care of the patient. For a caregiver, there is no such backup available in the current support system. So how do we create caregiver backup is also going to be a very, very important thing as we kind of go along. And especially, you asked a question about surprises. GvHD is a surprise that can come any moment. And as soon as any new surprise kicks in, there is a new level of anxiety that comes with every surprise. Okay, every fever that is 102 creates anxiety in both the patient and the caregiver. Any new skin rash or not able to eat creates anxiety at both levels. So anything that happens to the patient somehow has a mirror effect on the caregiver also. And that needs to be, I think, honored also, that yeah, this is very much a part of the emotional journey that all of us go through. So, when the patient is just about, really getting back to his normal self, he's taking care of himself, having bath by himself, he's actually coming to the dining table to have breakfast and stuff like that. And suddenly a GvHD can change the course of the entire thing where, you're just not able to move from your bed for a few days and you're like, what just happened? I thought I was in the part of recovery. What just broke down? So I
Right,
think those are moment of surprises that create extreme anxiety in both patients. So that is why navigating GvHD becomes even more complex issue. Saying, when am I going to feel better at all? How
mm,
am I going to kind of get back to what I would call normalcy? So
right,
every new GvHD or a complication adds to that stress level of anxiety, saying, I don't feel normal now. So when will I feel normal? So that's where I think, we'll have to really navigate that carefully. Yeah.
correct, correct. And it is a critical one, right? Because on the one hand, as both of you have said, you are declared cancer free. So everybody assumes that nothing is, that's the best news that could be, right? And then you are navigating these surprises of GvHD, which may seem not so, huge and humongous as having cancer, but then they do disrupt your life.
Yeah, I mean, everybody is like, now you have win over cancer, so everything is all good. But I mean, today I feel, at least when I have gone through all these years of survivorship, that fighting cancer was much easier than fighting these long survival issues.
Right, right.
And as Neeraj spoke about caregivers, and we were talking about the isolation period during BMT. So again, for caregivers, those things are also so difficult, because as a patient, definitely we are facing a lot of issues, but at least we know what is happening. But they are outside the isolation room and they don't know what is happening. So they are always in the thought process कि I don't know हमारा patient अच्छा है क्या नहीं है, क्या उसको दिक्कत हो रही है, all those things. And doctors are also updating them about the issues, so but they don't know what to do. And they have to take a lot of big medical decisions, because everything is new for them also, and they have to take decisions on behalf of the patient. So that is also a very tricky, very difficult part. And yeah, caregiver fatigue is such a big issue. I mean, I also in routine keep talking to cancer patients and caregivers, and uh, exactly same as Neeraj said. Caregivers are like, we have to do. हम बाद में rest कर लेंगे, but this is the time we have to do for the patient. But yeah, that's very difficult, and they are not recognized.
Yeah. Yeah. No, it's true. I think, I've always found that when you ask a caregiver how they are doing,
Yeah,
it kind of, they will come back and say, nobody asks me that. Every first question people will ask is, how's the patient doing?
right.
And, nobody asks us how we are doing. So I think that's at least we have to start with that. So, you've talked of, I think both of you have talked of your acute GvHD phase, but what were the first symptoms or early symptoms of chronic GvHD? What are the types of chronic GvHD that both of you have had? And I think we were already talking of the impact on quality of survivorship. So maybe you can again dwell on that. Neerad?
Yeah. So I think the early symptoms definitely uh, for me was the skin. I think
Mhm.
because immediately you start shedding a lot of skin, right? Because that's the first line of action that the chemotherapy does for you. So recognizing skin and how do you kind of, so this is one of also, in terms of information that needs to be broadcasted to a larger caregiver audience, saying what are the things that you need to look out for
Hmm.
when a kind of GvHD is kind of setting in. So this is one. The second is your liver GvH that kind of kicked in for me.
Hmm.
And that really took a long time. So every fortnight I would have my SGPT-OT levels checked and stuff like that. And then I was put on immunomodulators to ensure that, the checks and balances are kind of maintained and stuff like that. I was also on immunosuppression for quite a while, almost 3.5, 4 years.
Hmm.
So with steroids extending after the immunosuppression for about a year before being tapered down and stuff. So yes, there is a journey in terms of this happens, but Recognition of this one has to be through your regular medical checkup, which is very, very
Right.
important. And those are the drivers that predominantly will determine whether something is happening. Second, in case if there is gut GvH, you will have very clear symptoms of either very loose stools or very hard stools, stools with blood in it. So you have to be aware of not flushing the toilet. Every patient, at least for the first 200 days or 1 year, should every day look at the poop quality and kind of see what is happening. So that is a very important symptom. Lungs, obviously, as you keep recovering, you need to see if you can do, 1000 steps together, 2000. So that's a judgment that you will have to take in terms of a call, saying, how
Right.
well are you doing? Are you coughing so much that needs attention? Or is it just a regular dry cough kind of which is happening? So those are the symptoms which early on, I think if you catch it, uh, are kind of easy to navigate if you catch it early on. For example, IGVH was something where there was no preventive testing done for me. What happened was a steroid-induced cataract, and I underwent both the operations. And within 3 months, suddenly the IGVH kicked in, which like so imagine post transplant I started driving a car, going to my workplace every single day, and then suddenly I couldn't drive anymore. I couldn't look at the screens for work anymore. So this happens when you miss that opportunity for a preventive checkup for an eye and stuff like that, right? So I think those are some protocols which still need to be induced. But yes, as soon as the eye starts irritating, you quickly need to give it attention. Even if you think that there is dryness or blurriness or a little bit of a problem, you need to give attention. If you're coughing way too much, you need to give attention. If the skin has rashes or boils or something, you need to give attention. Stools, you need to give attention. And your overall health, you
Right.
should be able to step by step grow your stamina. And
Right.
if that is not happening, then all your blood tests will anyway reveal if there is a problem. So I think this is how you can kind of look at symptoms as you go along the GVH journey.
Right. And does there come a point where you say, now I can relax and I don't need to do regular tests and things like that, or not? I know Nikhil's shaking his head, and we'll come to Nikhil's journey. But Neerad.
So I think this is a part of accepting the new you, where we have to make sure that we do these at least once a quarter, even after you're fully clean, so-called in remission as per the doctor. There is still this inhibition, right? Saying, what if it relapses? What if it comes back? What if there is something else going on which I'm not aware of? Because what happens is that within this journey, and for both of us, it's been a decade, right? So you're talking about at least 1000 plus reports done
Correct.
on the blood checkups and stuff like that, right? So having seen that again and again and the fluctuations and everything, you're like, I just better off doing it every quarter, whether the doctor is suggesting or not. I will do it every quarter, irrespective. And if there's a problem, I go to him, or else I go to him only once a year just for a standard kind of meeting on how we are doing and stuff like that. But that becomes an integral part of the journey, and one should actually keep that as a part of the journey in terms of preventive checkup, where
Right.
you do a full body and also your eyes and your foot and everything, just to make sure that everything is in control. But it becomes an inherent part of who you are.
Right.
So, yeah.
Nikhil, to your journey on chronic GvHD.
So for me, as I told, acute GvHDs were not that bad, but once I had relapsed, DLI was done, and DLI works on the principle of GvHD basically. So my GvHD was more of induced, and my doctors told me before doing all that it's a double-edged sword. You will have survival most likely, but it will be full of problems. So my first chronic GvHD was lungs GvHD, and as Neerad was saying about it, it was so sudden. I was absolutely fine. Started doing my routine things, and there was a severe cough, breathlessness, and chest pain. Then when I went to my local physician, some scans were done, and there was severe pleural effusion, that is extra fluid around the lungs, and my hematologist was showed that this is lungs GvHD because of my history. So after that, further investigations were done, and I was admitted, and treatments were started. there was also biopsy, which was done through bronchoscopy. So one thing is, for almost all GvHD, definitive diagnosis is through biopsy. Diagnosis can be made based on symptoms, history, and other tests, but to confirm that this is GvHD, biopsy should be done. So my lung biopsy was done, and it was confirmed as lung GvHD, and then treatments were started. It was mainly steroids, and initially IV steroids, then inhaled steroids and oral steroids, and then few other medicines specific for lungs GvHD. And uh, before my cancer or this GvHD, my lungs were perfectly fine. I could do all basic activities, running, jogging, everything. And
Hmm.
suddenly all my activities were restricted. So that was a big shock and difficult to adjust to that part. And I had to take inhaler daily and other medicines. And sorry, one more thing was pulmonary function test. PFT is very diagnostic of lungs GvHD.
Hmm.
So that was done. And then, yeah, since 2014, my life has been severely affected by lungs GvHD. I have to keep inhalers and few other medicines all the time. Like some medicines I have to take routinely, some medicines I have to keep because anything can go wrong anytime. And all my plans are like they have to be very flexible because uh, as I said, I love traveling, so I make traveling I have plans, and suddenly one day before my symptoms increase and I have to cancel. So this has happened several times, but we have to keep living. So I keep making plans and I go whenever I can. But yeah, we have to keep that in mind. And if we talk about other GvHDs, I had oral GvHD, for which symptoms are basically burning sensation and dryness in mouth and some white patches in the mouth.
Hmm.
So, and next was eyes GvHD, which was again same as Neerad, very severe dry eyes, gritty feeling, irritation, like there is something stuck inside my eyes.
Hmm.
And another mild ones are nails and hair GvHD, in which my nails are very brittle. Anytime my nails can break. So again, in my bag, I always keep a nail cutter. So those are the things we adjust accordingly. And
Right.
few more things I want to highlight regarding GvHD is about follow-ups, as Neeraj said, okay, because chronic GvHD sets in after 3 months. It can
Hmm.
happen anytime in 1 year or later also. But that is the time when we are not usually in regular follow-ups with our BMT team.
Hmm.
So the thing is, we have to, like all the patients who have undergone BMT, they should educate themselves. There are a lot of resources on website these days. They can definitely, they should listen to this podcast, and
Hmm.
there are lots of resources. So they should educate themselves about what all GvHDs are possible and what are the probable symptoms. And one more important thing with symptoms is the symptoms of GvHD mimic symptoms of other diseases also. So
Hmm.
it's not if you have dry eyes or if you have burning sensation in mouth or cough or these symptoms, it's definitely GvHD. It can be other things.
Hmm.
And a lot of times GvHD is misdiagnosed as other conditions because most of the doctors which are not related to BMT or hematology, they are not experienced to manage GvHD, and they diagnose it as something else. So patients have to educate themselves. That is very important. And whenever they get any symptom, they should not get afraid that it's BMT because, sorry, GvHD. It can be GvHD. So they should have open mind and definitely discuss with your physician, discuss with your BMT doctor. And one more very important thing is, which I have said earlier also in many sessions, um, most people get BMT done at a distant place from their hometown because BMT centers are still increasing, but still they are not very, I would say, abundant. So you should have one local physician who may be your family doctor or any other general physician who knows your conditions and who can connect with your BMT team if required, maybe over phone call or email or something, and they can coordinate among themselves for your symptoms and your treatment plan and follow up long-term plan. So that is a very important thing. And if you get any symptom, definitely consult. Don't ignore. In any case, get regular follow-ups with your dentist, ophthalmologist, and BMT team, and regular basic blood investigations. As Neerad said, it doesn't harm to get a one simple blood test at least twice or thrice or 4 times a year. So a lot of things can be diagnosed. Even, in fact, my cancer was diagnosed on routine blood test only. So that is something very important, and this applies to caregivers also. Uh, because once we are cancer free or we are done with BMT, the thought is that everything is over now and we can have a so-called normal life. Definitely, we can and we should enjoy our life. We should move on from the disease and do whatever we want to do, whatever we like to do, try to be as normal as possible, but we can't ignore our health. Like we have to be much more, uh, I would say, focused on our diet, our exercises, meditation, as Neerad again was talking about meditation, that helps a lot. So all these things and regular follow-ups and never ignore your symptoms. So caregivers should also be aware of the symptoms, and if the patient is missing something, caregivers should also see if something is going on.
So, both of you have said, right, that and there are multiple organs involved in these chronic GvHDs. So in your experience, what worked? Did you kind of assume that every symptom related to the BMT and therefore went first to the BMT team? Or did you first go, for instance, when you had dry eyes or, kind of cataract, whatever, did you go first to an ophthalmologist or did you first check in with your BMT team?
I checked in first with my BMT doctor. So as I said, my BMT was done in CMC Vellore, but I was following up with one hematologist in my hometown. And whenever there was these kinds of issues, I would discuss with him. And he was, I would say, very straightforward to refer me to proper doctors. Like for skin GvHD, he referred me to a very good experienced dermatologist, and similarly to ophthalmologist, pulmonologist, all these things. And when things were diagnosed or like GvHD symptoms were confirmed that it's GvHD, I used to discuss with my hematologist in Vellore also. And they coordinated among themselves and made a treatment plan.
Right. Neerad, was it different for you?
No, I think pretty much similar. Your go-to person, at least for India, it's always have been, is your BMT physician. So that's the first person that you anyway go to. And I'll also tell you why, because one reason is that, for the first 1 year, there is a regular follow-up that happens.
So I think the first 1 year, maybe
Yeah.
even 2 years will be fine, right? But
Correct.
supposing
So
you get
what happens
symptoms
is that
after 5 years or
no, absolutely. So by then, what has happened is that you've established so much of comfort level with the BMT physician. And secondly, you are like, he's the only person who knows me in and out after the transplant, during the transplant, post the transplant. So
Right.
he's your first go-to guy.
Right.
And then, is when then he will say, no, this looks like, IGVH. So why don't you quickly go to an ophthalmologist? And they are the ones to refer to somebody who understands GvHD conditions.
Right.
Because then otherwise just walking into somebody else's clinic, they will, come up with, 1000 things that, or screen time bahut zyada hai, pani bhar raha hai retina mein, So there are, so many things that they could probably come up with. And you don't want to get into wrong medication after so much has already happened with you. So the first is transplant, and then through the transplant, there is a reference that kind of happens, either within the same setup of the hospital itself, because all transplants happen in a multi-speciality center. So usually, first go-to will be in, but if there is nothing available, they do not hesitate to refer you to anybody who's an expert in this area.
Okay.
So yeah, so that's the first go-to.
Right. Right. And so, and again, we're talking of, GvHDs that can go on, and you'll have both 10-year plus survival and still dealing with issues relating to chronic GvHD. So what are some of the things patients can do to reduce or prevent GvHD flare-ups and also improve quality of life.
Okay.
Neerad, you want to
Yeah.
go first?
So let me, I'll conclude. We've seen several patients over the last 5 years of BMT Support Foundation. And one thing we've seen where patients do very well is that they have a discipline of taking care of themselves.
Mm,
I think their oral hygiene is really good. Their skin routine is kind of really, it's like a well-oiled machine where they know that, this has to be done. In terms of food and the dietary restrictions, again, they are extremely careful of what to have, what to not. Uh, till the point that even getting help from a, professional dietitian or nutritionist is
mm,
absolutely welcome. Uh, for those who have been involved in transplants, because now there are, many, like many nutritionists who are involved in this. So, getting help from that is very helpful.
mm,
Then focusing on your regularity. I think one thing we've seen is getting back to work really helps to keep your mind busy and kind of getting there. So those are certain things. While going out, wearing a mask is an absolute necessity in case if you're going to public spaces.
mm,
So that is one thing that you can take up. Then carrying a hand sanitizer and stuff like that. Wearing full sleeved shirts with the caps so that you don't irritate your skin so much. These are, I think, small things that patients can take care of themselves.
right.
And if after that also something has to happen, and one of the most important things is not to regulate your medicines yourselves. These are doctors who've had tons of experience, have seen thousands of patients over the years. Please trust their judgment when they say that this much of steroid is necessary, because many people they start tapering them on their own, thinking that I will have this side effect, that side effect. Please don't do that, because as soon as you reduce the steroid dose, there is a flare up that happens somewhere else in the system. Doctors have to work on the checks and balances of the suppression plus the immunomodulation, and all these things is going on together. They know their stuff, so please trust them, and rather than don't start taking medications yourself. But it's always good to say that check up, ask him, and then kind of follow the routine till the end.
Mm,
Even if there is an antibiotic course that has to be done for 10 years, which is the 20th time that you're doing it, please do it all the 10 days and not stop it. So I think those are disciplined things that we have to do. Regular checkup is definitely one thing, which
right.
is even if you're completely free, once a quarter is important. And yeah, and then yeah, whatever comes up, first thing is report to your doctor.
Mm,
Don't think that you can handle it on your own. I think that's the only piece of advice I would give to patients who are kind of looking at this.
right.
Yeah.
Thanks, Neerad. Nikhil,
Uh,
what's been your experience?
so,
Yeah.
if you talk about prevention of GvHD or controlling it in a better way, first thing is again follow-ups. Don't ignore your symptoms and get a good insurance if you don't have it previously. It's difficult, very difficult to get an insurance after getting cancer, but still keep looking for it. There are some cancer specific policies because even after cancer, expenses can go very high, and manage your finances in a better way to keep something for long term management. Then in general, definitely regular exercises, at least moderate walk, stretching, some strength training exercises, yoga for all GvHDs, for all long-term issues. Good healthy nutrition with good protein intake, very good hydration, and infection prevention is always very important for GvHDs, mainly for lungs GvHD and gut GvHD. And even if you have any GvHD, you are on immunosuppressants and steroids. Infection prevention is very important. For that, mask when you go out, avoiding crowded places, avoiding friends and relatives who have symptoms, which becomes somehow tricky in India, but that is very important for you. And get using drinking clean water, preferably boiled and cold. Then avoid raw cut fruits and salads. Always have cooked food as much as possible. And if you are going out, as I keep traveling myself, so try to, I mean, not try to, make sure that you have food from a good restaurant, good trusted sources, and carry your home food if it is possible. Then same precautions like you were taking during COVID. Hand hygiene is extremely important. And mm, then coming to some specific GvHD, if we talk of skin GvHD, uh, full shirts, hat, protective goggles, and use of sunscreen. Sunscreen is extremely important after bone marrow transplant, even if you don't have skin GvHD, because there is little bit increased chance of getting skin cancers. So that is very important. And for oral GvHD, dentist follow up at least twice a year, even if you have no issues at all, and very good oral hygiene. Then for lungs GvHD, regular at least once a year pulmonary function test and follow up with your physician. That is very important. And if we talk about gut GvHD or liver GvHD, then there are lots of dietary suggestions. There are foods which you can take and which you should not take. That's a long list. So you should check about that. But basically, low fiber, low fat, and lactose-free diet. That is the basis for gut GvHD. And for eyes GvHD, there will be a lot of irritation. So don't touch your eyes, don't rub your eyes. If you have to touch your eyes, wash your hands properly and then do that. And again, protective goggles. Then what else? I think I've covered almost all major GvHDs. And that's it. One more very important thing is if you have any GvHD, you are most likely on immunosuppressant and steroids. Steroids can cause lots of issues. So be mindful of that. And one very common thing is muscle weakness and bone weakness. So enroll in some strength training program. It doesn't has to be a very heavy gym based program. You can do basic exercises at home also. And same if you have lungs GvHD, pulmonary rehabilitation program is very important, which is somehow not very commonly prescribed, but it makes a huge difference. And with steroids, you can have complications like cataract and infections, and then bone issues. AVN is very common, that is avascular necrosis of hip and knee and shoulders. So if you have any symptoms related to your joints, don't consider this is as a normal joint issue. It can be uh, this AVN. So consult a good ortho who is experienced in hip and knee issues, and definitely insist on getting an MRI. So these are some basic things. And sorry, one more very important thing is make your symptom diary. If you get any symptom, note down in a diary, and
Right.
then whenever you follow up or you consult with your doctor, you can discuss all those symptoms, because sometimes there are very minor symptoms which we think are not important, but from doctor's point of view, that might be important. And most people tend to forget those things, because when you are consulting your doctor, who are most of the time quite busy, you hardly
Right.
have few minutes and you forget things. So make a symptom diary, and also note down whatever doubts and questions you have. So yeah, that's all.
Excellent, excellent, Dr. Nikhil. Just one addition to, you've covered so beautifully, but I just need to
Thank you
add,
so
I think
much.
one mistake
Yes,
patients
definitely,
do.
definitely.
One mistake patients do is अपने खुद का घरगुती इलाज करने लगते हैं कि
Right,
किसी मासी का काढ़ा, किसी बुआ ने
right.
ये सजेस्ट किया, किसी मौसा जी ने ये दवाई बोली. Please do not get into
Do
that.
not.
Do not. Okay, doctors know what they're doing, and if
Yeah,
you've fully gone, then partial ayurvedic karte hain, partial ye karte hain. Please don't get into that. Stay
Yeah.
with your line of treatment. Don't mix, because people mix and then they have like all the metallic substances in the liver, and then they
right.
have all complications, and then they go back to the doctor and don't even share with the doctor that we are undergoing
Yes,
this. So this is something that I think patients have to completely avoid, is to trust the treatment completely if they have to, and then don't do anything that is home related. Maybe, at the most you want to do a haldi honey or something like that, which is okay, but please don't go beyond that to say that I will mix 10 different herbs and I will have this kada or this medication. Stay away.
Yeah,
Completely
that's
stay away.
extremely important point you have added. And these things, I mean, herbal things have somehow notion that they don't have side effects.
Mhm.
But thing is, they can have a lot of grave side effects, especially on your liver and kidneys. And during GvHD, liver is very commonly involved. So that can create a lot of problem because already because of your chemotherapy, of your immunosuppressant medicines and GvHD, liver is fighting a huge battle. And all these treatments, medical treatments, they burden your liver a lot. And if you take anything which is not required, not proven, and your doctor doesn't know, that can be really harmful. If you are very much, I would say, influenced to take anything, at least discuss with your doctor. And if they allow, then only go for that treatment.
No, I think very important point, both points both of you have covered. This is a huge issue that comes up, and there's a lot that we don't know, and it's one thing, especially if you've made it at home yourself with 2 or 3 ingredients, but when you buy these ready-made, you don't know what
Right.
is in them, so it just becomes much worse. One question that I wanted to ask also is, while we've been talking of GvHD, but are there other long-term issues that both of you would like to highlight uh, as a BMT survivor, other long-term issues that patients should be aware of, Nikhil?
Apart from GvHD and steroid related issues, what I think is very important and much neglected is the emotional part. Because all this, right from the diagnosis of cancer, the transplant, GvHD, and issues from the treatment, and then multiple side effects, then that's a cycle which goes on. You take medicine for something, then there are side effects. You again have to take medicine for something. So that I'm not saying it don't take medicine because that is essential, but there's a lot of psychological, emotional issues. There's a lot of fear, anger, irritability, and depression. All these are normal. Normal means you can have it. It's not you have to hide from it. You can't fight it, but you have to manage them. And taking professional help for these things is same as taking professional help for any condition. As you have taken treatment for cancer or for any trivial thing like a fever, you should take treatment for emotional, psychological issues also. There are lots of great psychologists, counselors, which can help you. There are lots of support groups, there are lots of patient advocates, and lots of resources are there. But you have to come forward and take help. You have to ask for help. Don't think that getting mental issues is something wrong or something bad with you. You should recognize this as a normal part of your journey. Because I mean, fighting so much adverse effects, so much of medicines, and lots of everything changes in your life. Your social circle changes. Most of the people lose friends and relatives and family members also, because once after the diagnosis, somehow people think they are not good enough to keep as their friends. And I mean, there are innumerable issues, innumerable things. Again, professionally also, people lose jobs. Uh, Marriage is a huge issue. After getting such a diagnosis, people don't get partners, or even who already have partners, sometimes they leave. So lots of things happen, and you need support. You have to manage these things. Mindfulness, meditation, yoga exercises can help a lot, but a lot of times professional help is required.
Right.
I want to give my example. Last year, because of lungs GvHD, I had a really bad year. It was the worst year since my diagnosis. Even cancer treatment was not that bad as it was last year. I was
Mhm.
totally bedridden. I was in hospital for 1 month, and few months later, I had to undergo a very huge surgery. And I was really depressed, really broken. I had lost all hopes. I didn't want to fight at all. and I had to take psychologist consultation. I had to take medicines, and one misconception is once you start these medicines, you have to take them lifelong. But that is also absolutely wrong. If you recover, medicines can be tapered off and stopped. So I had to take medicines for almost a month, and my condition was as bad, like I couldn't sleep, I couldn't take my regular medicines for lungs issues. I was not taking my nebulizations. I was really depressed. I had to be admitted in ICU also. But then with my peer support, with my wife's support, family support, and definitely with the psychologist and counselor support and the uh, psychologist medicines, I was able to recover. And that time I was totally bedridden. I couldn't move even a single step. I thought
Right.
my life will be in wheelchair no, right from this way. But today, after a lot of physiotherapy, pulmonary rehabilitation, and meditation, and all these therapies, I am able to walk again. I recently did a 1 week travel. I was daily walking a lot and enjoying my life as good as I was doing 1 year before.
Right.
So things can get gloomy at times, things can get hopeless. It is really difficult, but if you keep fighting, if you stay strong and focused, and very importantly, believe in your doctors, believe in your caregivers, in your systems, and in yourself, things can improve, and you can be as good as earlier.
Thank you. Thank you, Nikhil. Neerad, you'd like to add anything, yeah, in terms of other
Yeah, I
long-term
just
effects?
yeah, I just like to add, I think just a couple of points that probably India still shies away from talking about certain issues. One is intimacy related issues. I
Mm,
think India is a we really need to have conversations around intimacy and also onco-fertility. I think fertility post-treatment for women, is there a possibility to bear child? Should they save their eggs beforehand going for transplant? I think these are issues that still need to be spoken about in India. And I
right.
think we need to do a lot of work around this.
Yeah.
So, yeah, I think all the other points Dr. Nikhil has very well covered, but these are very important salient points that still need a lot of conversation. These are still considered taboo topics
Yeah.
where I think we are in an age we are talking about gender equality and all of that, and these basic things are still not addressed. And also social norms. There are a
Mm,
lot of social issues that people still face. For example, in terms of matrimony, finding the right partner and stuff like that, and also finding houses for people who have cancer patients. People don't offer houses on rent for them, even if they're looking for a rental apartment or something, because they say, I
that's
don't
during the
want,
treatment or that's even afterwards?
uh, particularly during the treatment and
Mm,
especially pediatric, which is where we've seen that a lot of these problems occur, where children are not allowed to play with the children and stuff like that. They say, no, no, we don't want this kind of influences and stuff. So there are still a lot of notions that need to be worked on in India. Yeah.
no, yeah, absolutely important points. And I think the oncofertility impacts not just women, it impacts men as well, again, depending on, the condition and so on. But yeah, these are all things that it's, we are getting better in terms of cancer survival, but we are not getting better in terms of how to improve quality of life of these survivors, right? How to we integrate and rehabilitate them back into society. I think that's something that is still a lot of work that needs to be done. Very quickly, I think we'll look at the last couple of points. I think one was in terms of, some of it we've talked of, but what would be the things that you would want to include in protocols from a best practice perspective? Because I think we still don't, when we discuss a treatment option, we don't lay down the journey of that patient after that, after that protocol is done. So, what would your recommendation be in terms of, some of the things that should be included in protocols? Neerad, do you want to go first for this one?
Yeah. So I think the first thing is that India needs to develop a protocol around survivorship care plans. there is no survivorship care plan given to every patient when he's kind of released. It's only the list of medications that you need to take, and at the most, if there is a slightly advanced hospital, maybe a diet plan.
Right.
Beyond that, there is no, in terms of how much physiotherapy is required, or how much this navigation in terms of for example, regular eye checkups is not built into the system. Regular other kind of, like, for example, pulmonary, classic case, right? It's not even built into the system unless you have a problem. So I think these are things that need to be integrated in the survivorship care plan. And this is a huge miss in India, where we don't have personalized survivorship care plan. So this is definitely an area that we need to address. Second, in terms of protocols, hospitals need to build GvHD experts. They
Right.
cannot have a bone marrow transplant minus a GvHD expert missing in the system. This is a huge miss, where GvHD related research is not happening in India. GvHD related protocols are not there. There are no experts who understand GvHD at that level. And if there is available, there is no directory of such doctors available on the internet anywhere. It is all within the closed circles. So
Right.
somewhere I think we need to build that system where there are conversations around GvHD, there are GvHD support groups. And I think that's a huge miss in India, which there is an opportunity also for people who are in this line of work to create these kind of protocols specifically for GvHD. And especially, once a year, what is the level of checkup that you need to do? For example, there are only blood related or genetic, or there is a, like a fish test kind of done, for all of that, to see whether there is donor stem cells and stuff like that. Beyond that, also, you need to have a protocol for your teeth, as Dr. Nikhil was mentioning, for your eyes checkup, for your overall body, like a typically diabetic protocol that is set in terms of your foot and skin and all that. I think there needs to be set up for this kind of survivorship. So
Right.
yeah, so those are things that are missing currently.
Nikhil, anything else you'd like to add?
I would say before transplant, when patient is counseled, they should also be informed about acute and chronic GvHD. Not too much to scare them, but at least little bit to give them information. And once transplant is done, hospitals should develop proper reading material with all the symptoms, all the identifiers of GvHD and other long-term issues and side effect profile and other things. Hospitals can also make videos. These days, everybody is on social media and YouTube. They can make some informative videos about at least basics. Then a lot of hospitals do BMT meetups, annual BMT meetups. In that, they celebrate and they do a lot of good things to encourage people. But they can also set aside a BMT follow-up clinic during that time. Then hospitals can and they should have some GvHD training program in which local general physicians can enroll, some
Right.
patient advocates can enroll, and a basic support group. These things can help a lot to keep patients aware of the things and uh, keep a regular follow-up. And as again, one important thing, as Neerad said, they should have a directory of people who are trained and who are expert in GvHD. Because every time we have to find ourselves. In my time also, again, I had very good ophthalmologist. He's expert, he's excellent, but he was very frank. He told me he has not seen GvHD patients per se, but he had treated a lot of dry eyes patients. And we both together worked upon our protocol and how to go with the things. But it is not easy for all the people, all the patients to get such ophthalmologists.
And also, I think I mean, hopefully it will, as number of BMTs increase, there'll also be a demand that will drive it to some
Right.
extent. But I think it also needs to be proactively done and not wait for the demand to follow,
And
right? So,
exercise programs are something which are very very cost effective and which can have very great results. In fact, as we were discussing one day, this can be a huge earning opportunity also for the hospitals. They can have exercise programs and patients can benefit from it.
right.
So that's very important.
Um, and that both of you are now patient advocates. So is there an advocacy effort or a patient advocate that has inspired you, motivated you? Can be local, can be international, anything.
So I think what inspired me was an organization called BMT Infonet in the US. And BMT Infonet has some extraordinary level of podcast details, YouTube videos, workshops, live seminars for every single topic of the GvHD, which very well explains the details and how it's going. And they also share the amount of research that is happening in that protocol.
Right.
And as a byproduct of that, there is a separate subgroup created exclusively for GvHD where there are people with chronic GvHD, going through the problems, all the new treatments are being shown to them. Any clinical trials for new kind of treatments are shared with them. So there is this proactiveness. So BMT Infonet really has kind of inspired me in my journey to start BMT Support Foundation. Yeah.
Thanks, Neerad. Nikhil?
So yeah, BMT Infonet is amazing website. A lot of resources are there, and I think as Neerad mentioned, that GvHD Alliance is what they have, where all the resources about GvHD are there. Whole lot of information, symptoms checklist, and support groups, and uh, doctors are also listed. But that's basically for US. And apart from that, there are few support groups on Facebook, particularly about GvHD. Two of them I am a part of. One is not just GvHD, and one is about lungs GvHD, and they are excellent. And then Patients Engage, your group is very resourceful. Lots of informative videos are there. And if we talk particularly about patient advocate, there is one Mr. Pranav Basu, who I know through Facebook. He's doing a lot of amazing work in palliative care. And whenever I see his post, I get so much motivated to work in that area. And currently, I'm not doing a lot of work in palliative care or in social circles. Mostly, I'm limited to patient counseling because my lungs issues keep propping up. And whenever I'm in a better condition, I go on a travel and those things. But I definitely want to work on his path, and he's very, very much inspiring.
Yeah, Pranavda is very, very
Yeah,
inspiring. It's quite a, I've
yeah.
known him now for
I
many,
mean,
many
yeah,
years.
so much selfless work, and he travels. I mean, a lot of time he has posted. He travels 10-15 hours just to see one patient in a remote locality, and that is really inspiring and amazing.
Thank you, both of you. I think we are well over our time. So one closing comment or closing comments from both of you. Nikhil, you can go first.
Uh, I would say, like say about cancer, it's a huge challenge. GvHD and survivorship also huge challenge, but with proper information, awareness, and right steps at right time, and good mental outlook, strong willpower, strong support system, things can be managed. It may not be as normal as your life before cancer, but it can be very near to that normal, and for some people, it can be even better because they are more focused on their self-care and self-love after getting such a diagnosis.
Right.
So I'd just like to add that I think there's a famous quote that says that it is both a blessing and a curse. So I think how you look at it is going to kind of matter. And, I was just mentioning about the 5K run that I did this Sunday. So this is organized by a group called Umid Kiran, where the tagline is very amazing, which says life is bigger than cancer. So I think one has to look beyond just the normalcy and kind of look to see how we can not only survive, but, go to thrive and kind of start doing things for others. So, there's just so much that you can contribute as an individual having come out from that. So please take every opportunity to contribute, be a part of the cause, be a part of the movement that's already being created here. And there's just so much more to look forward to than just the treatment. And I think for some of us, a lot of it has actually become memory. and living each day as it comes to the fullest and engaging in your work, whether it is social, non-social, with family, friends. I think, that really matters most. So
Right.
one should look at a life which is bigger than cancer, I think. That's
Thank
really, yeah. Thank
Thank you, Neerad, and thank you, Nikhil. I think it's been a really informative session. I'm sure anybody who is contemplating BMT or has finished BMT and navigating GvHD will find this session extremely useful. I think we've touched a wide variety of topics, from the need for better protocols, the need for more information. We've talked of the need to shift the conversation from survivorship, so from survival to survivorship, but also what patients can do, not just to manage their condition, but as Neerad said, to think bigger and live fuller lives. So I think we've kind of covered huge amount of ground, and I hope both of you enjoyed the conversation as much as I did, and I'm sure that people listening to it will find it's really useful. And I think to the audience that's listening, thank you for listening. And if you have any questions, you can always write into us at, you can comment on the feed, or you can write to editor@patientsengage.com. And if you ever have questions, we will always respond to you. So thank you so much once again, Neerad and Nikhil, for joining.
Thank you so
today.
much.
Thank you. Thank
Aparna,
you
for this
so
talk.
much for
Thank you.
such a wonderful session. Thank you.
Thank you.